to listen my lecture. I'll start now. No need to wait again. Today's topic, an interesting topic in homeopathy. You all know that uncovering the mystery of miasms. As a homeopath, why we need to know about the miasms? What is the purpose of learning miasm in homeopathy? Especially when we grow as a doctor, when we are started practicing on our own, having a private clinic, why we need, especially in chronic cases, why we need to know the knowledge regarding miasms. Why Hahnemann discovered miasm? Why he enlightened the miasm? Do anyone want to try through chats? Or shall I uncover the purpose of miasm? Do anyone remember regarding the organon aphorism where Hahnemann enlightened the miasm? Which aphorism? Hahnemann started revealing from the aphorism 71. He stated beautifully that as first types of diseases, the fundamental disease into two types, acute and chronic. Acute in the base of individual exciting cause, sporadic or epidemic. Chronic in the phase of miasm, psora, psychosis, syphilis. Till 81st aphorism, he has explained how to handle miasm in homeopathy and what is the purpose of handling miasm in homeopathy. He has beautifully coined the main thing regarding acute phase. We will see first. Exciting cause of the disease, which is considered as individual reason, especially it can be pseudo disease like indisposition state, or sometimes it can be an actual disease by due to infections like typhoid, COVID, cholera, dengue, chikungunya, or sometimes it can be related with acute panic attacks, acute chronic exacerbation of the acute phase of aura or epilepsy, or sometimes related with sudden rise of fever with unknown pyrexia. Whatever could be, he wanted to enlighten the main thing, the exciting cause of the disease through mental plane, which is very important in homeopathy to know the ailments from. What is the reason for knowing the exciting cause of the disease, especially in the acute phase? The reason is that to know the individual ailments, what is the reason for that particular person to get it. And again, we have to differentiate the individual stage of peculiarity by framing the totality. Before framing the totality, we have to arrive what is the reason for that particular indisposition or disease state. So ailments from, it can be related with sudden fear or sudden hearing of any news related with shock, or ailments from discards, or ailments from loss of loved ones, sudden grief or long-standing grief due to death of closed ones, or failures in exams or failures in the career or job-related stress or whatever could be, comes under the ailments, especially in the acute phases. And another two things in acute miasm we have to rule out is sporadic and epidemic. Epidemic comes under the epidemic state like cholera, plague, the certain area, elephantiasis, like that. Certain area only get affected, which is very highly infectious and highly contagious, comes under the epidemic. There we can consider about the rather than individuality, we can consider about the totality framing, which is very common among the group of people. Because if the people are in masses, we can't give individual attention, so that we can give importance to the uncovering the symptoms, framing the totality by taking the group of symptoms through masses by group surveys. In sporadic, then and there get affected. The live example we experienced around 2022 to 2022 regarding the COVID, where little people, few people affected then and there all over the world globally, which is considered as the sporadic diseases, where we can give importance instead of taking the huge totality, we can give importance to the individual framing totality, where we can recover the vital force, enlighten the vital force with speedy harmonious healing, where Hahnemann explained beautifully the highest ideal of mission in aphorism 1. Now I go to the topic of uncovering the mystery of miasms in the chronic stages, especially from 71st aphorism to the 81st aphorism, where Hahnemann highlighted the chronic diseases in 3 types: pseudo-chronic diseases, artificially induced diseases, especially use of high morbidity drugs through allopathy or certain high doses of medicines, high combinations comes under the artificially induced diseases. Pseudo-chronic diseases, which comes under the reason of use of drug addictions, especially like alcohol, cocaine, or highly toxic drugs like tobacco chewing, which man is creating on its own, comes under pseudo-chronic diseases, and also the disease related with the due to poor environment or poor weather, where the people residing in group in mass, especially in the marshy districts or in the slum areas where the hygiene is very poor, where the maintaining cause is persistent, which is the ideal reason for their contamination of food, contamination of air, and contamination of water, added the main reason for pseudo-chronic diseases. The pure chronic diseases comes under the miasm, which we are going to uncover it, the mystery, through tabulating into psora, psychosis, as well as this. So, psora is the first miasm, where Hahnemann coined out through the scabies and itching, where he enlightened the 2 stages of miasm, especially in the psora, like pseudo-psora as well as the true psora. Pseudo-psora comes under the, especially in the indisposition state, where especially the individuals who are highly intellectual and highly sensitive, both physically as well as mentally, where they give importance to the situations where they get affected by their emotions. For example, the students or the job going people, where they have the constant anxiety or anticipation of fear of failure or fear of future or fear of misfortunes or fear of facing the examinations or fear of facing the interview, especially taking the new job, taking the career. So these acute ailments comes under the pseudo-psora phase, where their mental and physical anxiety adding up the reason for their diseases appearing. So considering the true psora phase, where the people, the individual, the particular personality comes under the predominant. Of course, all the humans comes under all the stages of miasms, one or two stages combined together, or one miasm predominantly stands there, where we can see the huge symptoms through the expression of the individual. So considering this, we can able to differentiate what is the actual stage of the particular miasm in the particular individual. So considering these things, we have to first understand that each and every miasm through the features, the generalized features as well as the characteristic features of the individual miasm, which helps to rule out what is the exact stage of the miasm considering the diseases. Some group of diseases comes under the particular miasm, and some symptoms including particular symptoms, mental symptoms and physical symptoms comes under the miasm. So this is the purpose of Honeyman, who is a legend, have given a wonderful system of homeopathy where he has a deep-seated knowledge to give us, a gifted us, even we are able to practice in our modern lifetime. Where he helped us to understand the knowledge of the disease, knowledge of the person, knowledge of the miasm. That's why Hahnemann initiated every homeopath to be a successful practitioner. We have to be an unprejudiced observer as well as a keen observer. Keen observation is very important in practice to arrive the sublimum. For that, the knowledge of the disease is very important, the knowledge of the miasm is very important, and knowledge of the constitution is very important, and the knowledge of the particular person expressing both mentally, physically and verbally is very important. Before considering the symptoms of the regarding the behavior of the person is very important, more than understanding the feature of miasm, which helps to understand within few minutes. Each and every miasm of the person constitutes through behavior, by the way of sitting, by the way of talking, by the way of standing, by the way of walking. So every behavior of the particular person helps to understand the beauty of the miasm before arriving or before concluding what miasm they can be. Considering the psora, being an intellectual personality, intellectual miasm, they always have the behavior of everything in the routine activities in the fast manner, expressing everything in the fast way, like talking fast, walking fast, doing all their regular course, regular activities very faster. This is the key symptom to break out before concluding the miasmatic part in a particular individual. So, what could be the physical build-up considering the psora? Through facial expressions and facial build-up. Do anyone want to try? What could be the reason for facial expression? What is the reason of showing out? How they will express out? How the facial features will be considering psora? Do anyone want to try? Especially in psora, all the features will be very sharp features. Even the build-up, even the constitutional type, even the features in the face will be very angular. The angular chin, the triangular shape, sharp features, sharp nose. The eyes won't be that much protruded. The eyes will be deep-seated. The sockets will be very hollow. They look almost like a malnourished thing. Psora highlighted with the facial inbuilt of triangular features. Always they will mimic the redness in their cheeks, the pseudo-plethoric state with especially with teenagers or around 20 or 30, they will express through the acne and pimples in their face. Sometimes it can be painless or painful. So always they will express their cheeks through redness, the pseudo-plethoric state. This is the facial feature of the psora. Highlighting this particular thing, considering this, their inbuilt will be very emaciated. We have to differentiate this emaciation from the syphilitic as well as psora, because both the miasm will be very thin, lean and emaciated, but the differentiating point considering psora with syphilis is that psora face and the psora skin tone will be highly fresh and highly healthy, though they are emaciated, though they are lean and thin. In fact, inbuilt health also represents through the deficiency of the vitamins and minerals won't be that much less. They will have almost normal vitamin levels and normal mineral levels in their body, considering the syphilitic stage where they are highly emaciated due to the huge loss of vitamins and minerals, where their vital force are very weak. They show the facial expression with the skin of wrinkled, with the old age look, premature aging, graying of the hair, with wrinkled face, frowning of the eyes, frowning of the eyebrows, always expressing through the sadness and sickly appearance, always slow in their mannerisms. So this is the high differentiating point from psora with syphilis, the emaciation, where it is the highlighting point to differentiate, very easier for us to differentiate that particular thing. So considering the mental part in psora, we have to always remember the main thing of what is the reason for the psoric stage of miasm in psora. What is the reason for that particular thing? The main reason for psoric emergence in the particular body slightly altered from the indisposition state. The reason is that the false evil thinking starts, the desires, the abnormal thinking, the evil thinking starts with the psora rather than syphilis. Here again, this evil thinking should be differentiated from psora as well as syphilis, because psora also will have the evil thinking. Even in psychosis also there will be evil thinking. Even in the syphilis also there will be evil thinking. So we have to differentiate. That's why Hahnemann have enlightened this as false evil thinking in, especially in the psora, rather than in psychosis as well as syphilis. So the beauty lies in the thinking of always the anticipation, evil thinking in the, not in the form of any false desires, not in the form of craving of alcohol or drug addictions. It's not related with false evil thinking. It comes under the drug addiction, tobacco chewing, alcohol, all the craving for stimulants, all the evil thinking, connectivity with abusing others or self-manipulation or mutilating their own bodies or mutilating others or expressing through sexual affairs illegally only with the syphilitic. That is the true evil thinking, where in psychotic phase this evil thinking completely change only with the show off. They always tries to be very seeny. They always wants to outlive the, both mentally and physically, that they are superior than others. This is the evil thinking part of psychosis. They want to dress up with very beautifully elegant and want to spend more in luxurious things. They will buy expensive cars, they will buy huge branded dresses, branded watches, branded accessories, branded electronic gadgets, which is highlighting the show of personality. They enjoy going parties, they enjoy dance, they enjoy music, especially in the psychotic phase. In psoric phase, always the evil thinking is connected with the desire, the anticipation. Instead of desire, it is connected with the anticipation, anxiety. The anticipation connected with fear of failures, fear of position of losing job, especially in career or especially in achieving something where they are dreaming high. Especially this predominant anticipation is seen in the students who wants to achieve in their careers, in students of school going and college people. The fear of job or fear of losing the position seen in the people who are taking the job or attending the interview. Even this psoric phase is enlightened with the anxiety towards the appearing or going to the function itself. Even we have learnt, especially in gelsemium, examination of the fear, ailments from the appearance of the examination. 2 days or 1 day before appearing exams, they will develop diarrhea. Even this highlighting symptom is seen in argentum nitricum, even in aurum metallicum, even in arsenicum album. This highlighting symptom is seen. The reason is that fear of making mistakes. That is the main reason for the RSAL patients to be highly have the anticipation of appearing something or doing something, thinking that they will miss the 100% end result. They will do mistakes because RSAL patients always have the nature of developing guilty regarding the fear of making mistakes. Argentum nitricum will have the symptoms of anticipation of appearing something, especially attending church, opera, or attending going parties or attending marriage functions or birthday parties connected with the time management. They always wants to be very punctual because argentum nitricum always likes the appreciation, always wants to be the center of attraction. That is the main reason for them to have this nature. So, anxiety or anticipation in any form comes under the false evil thinking in psora. This false evil thinking, the anxiety and the anticipation in their later stages build up with the disease of psora, especially when the psoric people have the anticipation that something is misfortune is going to happen with their loved ones. This is the striking feature seen in which drug? The anticipation, the fear of misfortunes. Something is going to happen with the closed people, closed ones. Do anyone want to try it? What drug comes under this feature? Especially the drug comes under cinchona officinalis. They always in the dream, especially rather than thought process, they have the dream of fear of misfortunes or fear of accidents is going to happen to the closed ones. That's why this anticipation makes them to develop the always in the deficiency, the anemic state. So, this anticipation and anxiety makes the psoric individual to build the base of the future disease, which in later stages develop into physical expression of hypersensitivity as well as mental sensitivity. They always have the mental sensitiveness. This had the great value in building up diseases in their future. The anxiety and the anticipation is the key feature for developing the adrenaline emotions, because we always know that adrenaline is the flight hormone, where it helps us to fight against the emotional disturbances, especially in the acute shocks or acute panic attacks, or when the people who are having high altitude driving or choosing mountain hiking or living in the high altitude, the people who are living in the high altitude, and the people who are driving scuba diving, submarine, traveling, they always have the adrenaline, where the people other than living in the mountain areas or going for mountain trekking or who are choosing scuba diving or submarines, the remaining people who are living in the plains, who are in the land areas, they should not have adrenaline insufficiency, dysfunction, because it initiates the antihistamine secretions, which initiates the urticaria symptoms. Sometimes the huge flare-up of the urticaria high symptoms makes developing the anaphylactic shocks, especially common in acute shocks or acute fears, irresistible fears, develops into urticaria connected with the breathing disorders. Oxygen insufficiency leads to sometimes acute respiratory dysfunctions as well as acute respiratory failures. So this should be handled very carefully, especially with the homeopathy, by selecting an acute symptom. These phases comes under the psoric phase, where they are getting disturbed by acute stages, acute flare-ups of the vital force weakening due to their huge anxiety and huge fears. So, in later stages, they started developing slowly with the fear of, leads to mental depression, overthinking, overclouding of thoughts, thinking always the real thinking of their problems, or dwelling on the past bitter events, always having the future anxiety, later developed into the physical restlessness as well as mental restlessness, which resulting in insomnia. Always they have the sleep deprivation. This sleep deprivation leads to later stages of gastric ailments, because anxiety, anticipation, dwelling on the past bitter events, fear of failures, and insomnia connected with the fear of dreams, anxiety of the dreams, always connected with the gastric disturbance, with the high secretion of HCl in stomach, which leads to gastritis and related with all the inflammatory disorders of the intestines. The initial stages of ulcerative colitis, gastroenteritis, gastritis, which expressed through the acute vomiting, sudden diarrhea, or sudden acute panic attacks, or sudden hives due to adrenaline dysfunction. So, this is the psoric phases, psoric stages, where the mind and body is connected with the expression of the miasm and the expression of the diseases, where they develop because of fear, they become very weak both physically and mentally. They become very mild, yielding and timid. The timidity is the highlighting feature in psoric personalities, where they can't fight for themselves. The survival of the fittest will be very weak, irrespective of any genders, irrespective of any ages, especially the personalities who comes under the timidity. So because of the timidity, they always have the sense of fatigueness. Always feels weak both physically as well as mentally because of the overthinking and overclouding of thoughts rather than through diseases. This physical fatigue is highly seen in syphilis as well as psora. Psora, physical fatigue due to the overthinking of the thought process and mental fatigue. Physical fatigue is common in syphilis because of the diseases, because of the latent syphilitic stage where the vital force will be seen in very minimal or almost zero in the death stage of the particular personality. So here the mental fatigue leads to physical fatigue, which is a characteristic feature of a one drug. What is the particular drug? Do anyone want to try? All the Cali groups. That's why Cali personalities never gives importance for the mental work. They never give importance to the thought process. They can able to initiate their work only through learning for many years, only by the commanding from others. Only with the instructions they can do it, perform it as a robot. So this is the enlightening feature of the psoric mental fatigue, where it leads to the physical fatigue, always feels continuous yawning, always they want to prefer the cat nap sleep, which is a cat nap sleep is very common in lycopodium because they miss the deep sleep in the night time because of the insomnia, because they are highly intellectual. The lycopodium personalities are highly anticipated, highly intellectual. The anticipation, the fear of failures, the anxiety about the future makes them to have the daytime sleep for few minutes. So all the psoric personalities are highly intellectual personalities where they miss the deep sleep in the night times, which leads to the short time sleep in the daytimes. Because of the insecurity about their future, insecurity about their job, which is the striking feature seen in Naxomica personalities. Again, the Naxomica personality comes under the highly intellectual personalities. So, each and every symptom is beautifully related with every drug, every characteristic striking feature by the Hahnemann and the different authors of homeopathy. So, arriving the sublime lies in the beauty through knowledge of disease, knowledge of miasm, knowledge of the drug picture, insights of the deep learning of each and every drug, connecting always with the doctrine of signature as well as considering the toxicology part of each and every drug and the habitat of the source of the remedy. Always connected beautifully with the every human being with the personalities. So, this constant anxiety leads to the profound sadness, irresistible sadness, anxiety, the dread of being alone. They always have the aversion towards the solitude, aversion towards staying alone because of the fear of staying alone, because of the unwanted fears, fear of darkness, fear of sudden sound, fear of excess noise, fear of lightning, fear of ghost, fear of evil spirits, fear of war, fear of natural calamities, fear of famine, fear of poverty. All the fears comes under the psoric phase, which makes that particular personality to the dwelling of the profound fears. Today I will try to complete the psoric miasm. We will highlight the point of psychosis and syphilis in the next sessions. The main thing is that as sudden change of live session from Insta to FB, I couldn't connect many people here. So that is the main reason for me to think only related the insight points of highlighting only the psoric miasm. This profound anxiety always leads to the forebodings, the fear of death, the anxiety of the health, anxiety of the disease and anxiety of the illness. Always thinking that they will become bedridden. Even for the slight indisposition, they develop that fear of they are going to get the disease which are not able to be treated with any system of medicine. The death is going to be predicted by their own. No medicine can save them. No one can save them in their life. The fear of death makes them to develop the prediction of their own death. The lack of willpower, especially during the disease phase, during the acute stages of their anxiety and the fears. Of course, psora comes under the strong will as they are the highly intellectual personality, especially when they are in the healthier state as well as pseudo-plethoric state, where they have the strong willpowers, especially they show their willpowers in their achieving dreams, in their determinations, in their careers, in their knowledge gaining. So, the willness will be weak, their willpower will be weak, especially in the psoric state. This is the beauty of homeopathy and the beauty of the psoric stage, where Hahnemann coined especially each and every symptom. What is the reason for that? How they express out. If they express out, what will happen to their body, both physically as well as mentally? How they express outside. Because each symptom and each disease which is expressed outward only through the internal derangement or internal dysfunctions. So, the psoric stage starts with the survival of the fittest, the fear of handling themselves independently. They always need the support from someone. They always need the attention. They always need the care and love. They need the moral and support, physical support, mental support, money support. They always need the triggering force, especially in the psoric stage, as all their intellectual levels get masked because of their anxiety and the dwelling of their fears. This is the main reason. Sometimes this dwelling of fears makes them to live in the fantasy world, to live in the delirial state, to live in the illusional state, the false hallucinations, especially expressed in the acute fevers, where the person, especially in the high fevers, they started muttering something, they started blabbering something because of the delirial state, which comes under the psoric phase. The expression of telling something in the delusion and illusion state for a short period of time comes under the psoric stage. If it remains in a particular individual, especially the delirium, illusion or hallucination, which seen inward as well as expressed outward for a long period of time, for the long stage, comes under the syphilitic miasm, like bipolar disorders, multiple personalities, split personalities, comes under the syphilitic miasm. For a fraction of a second or for a fraction of few minutes, especially in the acute stages of fevers, the delirium comes under the psoric stages. So, because of this impact of the frightened, because of the weakness of the vital force, because of the masking of all their positive characters, all their calibers, all their capabilities, because of the anxiety and because of the anticipation, makes them to develop in the later stages with the huge diseases, slowly developing diseases. So, considering this, the head symptoms, the scalp symptoms, starting with the scaly dandruffs, the papular eruptions because of the constant rubbing of the hair, and acne, sebum collection, sebum obstruction, appearance of the acne, painless or painful pimples without discharge, or small eruptions like vesicles in the acne form, especially in the teenagers, which disappears on its own without scar formation because the psoric individuals never poke the acne. They never manipulate their body. So because of that, without treatment, especially the dandruff, which is very less in the initial stages, and the acne, which is without discharges or without pain, goes on its own, heals on its own, with our immunity, with our vital force, without treatment, without scar formation. So this is the beauty of the human body, where the self-healing process is always initiated by the dynamic force, the vital force. Even vital force is the reason for us to stay healthier, to live healthier till the death. I will complete the session around 9 p.m. so that hope I can cover the psoric stage of the miasm. Considering that the hair always will be in such a way, though there is dandruff, though there is the initial stage of the dandruff appearance in the scalp, the hair won't be lost in huge bunches. The hair fall will be very less, so that the psoric individual always have the long hair with more dense hair. But the predominant thing is that in psoric stages, because of the overthinking, they always express with premature graying. You always should remember that premature graying will get differentiated in psora as well as syphilis, because in syphilis also premature graying of hair will be seen because of their evil thinking and evil behaviors. Like I already told in few minutes before regarding the evil thinking and false thinking in psora and syphilis. This premature graying of hair in psora can be easily cured in a short interval of time if we can able to find out simlimum, especially under the covering miasm of psora. When the functional disturbance is the predominant expression of that particular individual, both physically as well as mentally. So, they always have the dry eczematous eruptions in skin also, especially the acute urticaria and acute atopic dermatitis and flare-up of some of the side effects of allopathic drugs, especially the sulfur content. Even some people I have treated where they will express the urticaria symptoms because of use of paracetamol, because of use of salbutamol drugs, because of use of sulfur drugs. That's why Hahnemann has differentiated the chronic diseases in 3 types. The pseudopsora, artificially induced chronic diseases because of use of allopathic drugs or because of the drugs which created the side effects. Even the vomiting or some sort of sensation like burning or numbness sensation because of use of drug effect, even the drowsiness, the letharginess, especially when we are using steroids, this comes under the psoric stage, where it can be easily treated by the acute drugs by arriving the simlimum. It can be beautifully treated with knowledge of drug as well as knowledge of framing totality of symptoms with the individual peculiarities. So, considering this scalp and skin symptoms, sometimes in psoric stages, this atopic dermatitis can be cured without even medicine if the particular personality can able to eliminate the mental ailments and the mental cause of the exciting cause of the disease. For example, you can wonder that how the main thing regarding the atopic dermatitis or the acute itching or the scaly eruptions without medicine intervention, how it is possible to cure it. How the individual can able to cure it, especially in the initial flare-ups, especially in the psoric stage, in the initial flare-ups, where they can able to identify the exciting cause of the disease. Once they understand the exciting cause of the disease, because the people who constantly learn from me will know the exciting cause of the disease for the skin disorders especially. The reason is that related with the main thing of detachment. Detachment from the closed ones. Detachment from the closed people. It can be connected emotionally or it can be the true reason. For example, the lack of love or lack of care can be the reason for the sensation of detachment from the closed people, sensation of detachment from the family members, or sometimes the detachment because of the, especially with the child, with the mother connection, where the mother failed to accept the baby, where the mother is not ready for the getting pregnant, not ready to deliver the baby, where the baby initially within few days after birth developed the atopic dermatitis. Unwanted pregnancy, unwanted willing to accept the pregnancy, where the babies develop the atopic dermatitis, where there is no need to treat in the babies. Instead, you can give medicine to the mother or you can teach the mother to understand the acceptance of the babies. Even sometimes when the baby is born with certain type of disorders, physically or mentally connected with the life challenging disorders like mentally retarded or ADHD or autism or hyperactive babies, where the mother is not ready to accept the babies because the mother as well as the baby started facing the acceptance from the environment, acceptance from the own family members, acceptance from the society, where they face the survival of the fittest. That's why I already told you that regarding the considering of the psoric phase, where they have the challenging in survival of the fittest because of the main reason of facing challenges both internally through their lack of acceptance or through the environment of society or the people or the family members who start ignoring the affected people. These people, these personality comes under the predominantly with the psoric stages of miasms. They always have the predominance of psoric stages. So, considering this mental part, by giving mental counseling, we can able to remove their mental thought process healthier with positive, teaching them positive attitudes, helping them by giving mental counseling, helping them along with selecting simlimum through the mother rather than babies. Until unless then the baby needed the medicine. It doesn't mean that every newborn baby doesn't need medicine, only the mother should be treated. You should not understand in different way. Because mother is always connected with the emotions, with the root cause of emotions. So we have to think about that. So considering, sorry for the interruption. So considering this, we have to, that's why I said that knowledge of disease is very important, knowledge of the miasm is very important, knowledge of the drug is very important. Knowledge of framing the totality is very important to arrive the similitude. So considering the physical generals, especially related with the sleep, I already completed. Considering the thermal part, the psoric individuals always will be more chilly rather than hot. What could be the reason for more chilly rather than hot? Why the psoric individual is like that? Though they are healthier, why they are more chilly rather than hot? The reason is that they can't able to withstand. In fact, we can tell psoric comes under the ambithermal. They can't able to tolerate both hot as well as both chilly extremes. The reason is that physical build-up, the lack of fat, because of the lean thin inbuilt, because of the mental hypersensitiveness, had up the physical hypersensitivity to the external impressions like environment, atmosphere or weather. Even in the closed places, they develop the suffocation. They have the all type of dysfunctions and indispositions even for the slightest cause because of the mental sensitivity. The physical sensitivity expressed through unpleasant smell makes them to develop nausea or headache. Even the pleasant smell like highly aromatic odors like petrol or diesel smell or closed places like traveling in car, traveling in aeroplane, they will have traveling sickness as well as motion sickness because of the mental sensitivity leads to physical sensitivity. Even they will have the dread of downward motion like the symptoms seen in borax. Borax always comes under the psoric predominance as all the borax symptoms comes under the scaly eruptions, itchy eruptions with dread of downward motion, with even the discharges with the menses symptoms as well as urine symptoms connected with psoric features. So, every drug should always be connected with what stage of miasm is predominant in that particular drug regarding considering the materia medica. So, even in all the phases, the excess sound, excess noise makes them to develop the headache. Psoric headache always will be more seen in throbbing type of headache in face, in parietal and temporal region rather than vertex or occiput. So, all the temporal and parietal headaches comes under the psora headache where they express through the sensation of throbbing as if the head is going to burst out or someone is hammering inside. They started showing the sensations of these type of headaches. Because of the headache, they develop the vertigo. Vertigo always connected with headache, especially during headache, because of the dizziness, they can't able to walk properly. They stumble in walking. Sometimes they fall down because of the dizziness. The long-standing headache developed from the temporal region travels to the vertex and travels to the back of the head. The headache starts from temporal, parietal, vertex and back of the head. They always get better by taking rest, lying down, even sometimes they no need of medicine in any form, painkillers or homeopathy. If they simply calm their mind and take rest, if they simply lie down in a silent room, helps them to recover their headache. Sometimes if they drink internally the hot water, if they take warm applications like hot water compression or steam inhalation without adding anything, helps them to overcome their headache. This type of psoric headache, the ailment starts from the mental fatigue, mental exhaustion. Even the slight mental exertion makes them to be easily prostrated. The developing of anxiety, thinking that they can't able to cure their problem. The developing of the anxiety of the illness, which will be predominant. Their eye symptoms will be developing with dysfunctions of they can't able to tolerate especially the sunlight and daylight. This makes them to develop the headache, which is the striking feature seen in natrum corp headache, belladonna, glowing, natrum sulf, where the headache, the root cause will be exposure to the sunlight. That is the main reason for them to develop the headache. So, the eye's dysfunction is always connected with the high exposure to the bright lights or high exposure, they develop the photophobia. They develop the watering of eyes because of the constant exposure to the straining the eyes, using the electronic gadgets for a long time because of the exposure to the LED rays. So, their odors always connected with the sensitive to the smell, as I already told regarding the both pleasant and unpleasant or highly aromatic odors makes them to develop nausea or makes them to develop the temporary nose block because of the aroma leads to suffocation. They will be more sensitive, expressing through sometimes with vomiting because of the long-standing exposure to unpleasant smell like sanitary issues or drainage issues or connected with petrol, diesel or traveling for a long time in the closed places makes them to develop. Considering the ear symptoms, all the initial stages of inflammatory diseases like otitis, externa, interna or media without discharges comes under the psoric stages. The initial stages of the inflammation comes under the psoric stages. Even in the nose part, it comes under the expression of rhinitis, continuous sneezing, especially after waking up without any reason because of the change of weather. Even some people, we always elucidate the symptom of continuous sneezing without need of remedy, only after waking up in the morning or only because of rain, sudden rain or sudden change of weather from extreme hot to cold or extreme cold to hot makes them to develop only continuous sneezing and watering of runny nose with the redness of the eyes. This initial stage of rhinitis without any discharges or nose block, without loss of smell comes under the psoric stage. Regarding nasal symptoms. Considering the ear symptoms, all the sudden exposures like traveling in the high altitudes, blocking of ears because of the lack of oxygen, while doing scuba diving or while traveling in the sea sickness, mountain sickness, always connected with air block because of the lack of oxygen, because of the deprivation of the air leads to air block, disturbance in the hearing or the constant inflammation in the initial stages of the any type of otitis layer of the ear with buzzing and ringing of ears or intolerable or unbearable to the sudden sound or ear block comes under the ear symptoms of the psoric stage. All the functional disturbances, dysfunctions without any derangements or without any disturbance in the cells or layers of the each and every epithelial layer or every organs comes under the psoric stages. Only the dysfunctions, only the functional things comes under the psora. So considering the throat part, it also comes under the sore throat. The feeling of pharyngitis, the overuse of the voice, the hoarseness of the voice, especially seen in singers, seen in teachers, motivational speakers, public speakers, the people who always uses their voices for the oration, for the speeches, develop sore throat frequently with the hoarseness of the voice, with the tingling sensation and something is sticking inside the throat without any discharges or without any mucus or plum formations. They simply express out like choking sensation or even the globus hystericus comes under the as it is connected with the mind, with the fear, especially expressed in ignitia, comes under the psoric stage. This globus hystericus, also seen in lachesis, difficulty in swallowing, it's not an imaginary thing because of the derangements, because of the destruction of the vocal cord or the larynx, makes them to develop the dysfunction of the difficulty in swallowing. Even they can't able to drink the liquids, or even they can't able to swallow the solids, especially seen in all the mercurial drugs as well as lachesis. So this expression comes under due to the destruction of the particular part, especially predominant in lachesis as well as all the ophidia remedies as well as mercury remedies. This functional disturbance of globus hystericus, the imaginary difficulty seen in ignitia where the predominant miasm or the personality is highly intellectual, comes under the psoric personality, the ignitia amara. That's why homeopaths prefers to choose ignitia as a acute remedy rather than chronic constitutional remedy. Even ignitia is a acute remedy of the natrum mure. Natrum mure comes under the constitutional simlimum. It is a polycrous remedy. So they will always have the acute tonsillitis only with the redness without formation of any follicles or stone formation or any quinsy, the abscess formation in the tonsil. Only the redness is expressed out in tonsil rather than enlargement, which comes under the psoric stage of tonsillitis, where it can again be treated only with doing salt water gargling or doing frequently drinking warm water without need of acute remedy unless then there is no emotional connections. When there is exciting cause is not connected with mentally or emotionally, there is no need of acute selection of remedy, because such expression always comes under the pseudo-psoric stage, pseudo-plethoric stage and indisposition state, which gets altered, which can be recovered back to health without medicine support. So this is the need to understand the differentiation of each and every stage of miasm, each and every stage of knowledge of disease as well as knowledge of symptoms expressed through every individual. The exciting cause of the disease is very important to understand the need of remedy or there is no need of remedy in selecting. Regarding the teeth symptoms, again the psoric stage comes under healthier teeth only with the expression of the weaker gums, with the expression of vitamin C and zinc or vitamin A, like showing it through stomatitis and gingivitis, only with the redness without any athe formation or without any ulcer formation or without any foul smelling in gums or mouth. They will have only sensitive to the teeth regarding considering the drinking and eating. They feel the pain, which will be highly sensitive and highly intolerable, especially regarding the pain. Whenever they are trying to take extremes of heat, like hot beverages, extreme hot tea or extreme hot coffee or extreme hot spicy foods, or trying to take freezed things, freezed ice cubes or more stimulated freezy puddings or freezy chocolate cakes or freezy brownie or freezed form of ice creams or freezed form of any cold beverages. Makes them the sensitivity regarding only the expression of pain which can be elucidated without remedy by correcting with only with the supplements, because correcting the vitamin C and zinc level and vitamin A level through supplements or the through source of taking highly rich foods. So, considering this, the psoric individuals, considering the thermal, they always have the aversion to cold. Sometimes they will tolerate hot, but they never tolerate cold because of the aversion to the cold as well as lack of fat makes them not able to tolerate the cold in psoric stages. They always have the expression of the regarding thirst. The psoric stage always will have thirsty. They will drink a lot or drink in moderate levels, with proper intervals or with the long intervals. That's why all the acute remedies, especially with the psoric phases like Staphylococcus, Ignatia, Axomica, Veratrum Hersal, all aconite, they have the thirst. Bryonia, Belladonna, these are acute remedies with the predominance of psoric stages where it always connected with huge thirst. During sleep, the psoric stages, the psoric individuals always have the cramps. They will always develop some muscle cramps, twitching of the muscles. We all know that being a homeopath, the personalities who are expressing about their sleep, especially in the psoric stages, it's not connected with RR, not connected with the neural disorders. They simply say that constant keeping of hand or constant keeping of legs in one position makes them to develop the twitching of the muscles in the form of cramps or numbness, or holding the hand with phone for a long period of time, or writing for a long period of time, or driving for a long period of time, either related with cycle or holding objects connected with cramps or numbness, always comes under the psoric miasm, as it can be altered, the numbness or the cramps or the pain can be altered completely without use of medicine on its own, where we remove the avoiding the particular work by keeping the phone down, by stopping the cycle riding, by stopping the bike riding for few seconds or few minutes, or stopping few seconds riding helps us to overcome the cramps and numbness. These functional disturbances comes under the psoric stage. Because of the constant dysfunctions, the psoric phases, the psoric personality predominance always wants to lie down, equally like doing the work in a faster way. Because since they are doing their routine activities in the faster way, faster walking, faster talking, faster eating, doing everything in a hurry, want to complete everything in a faster, makes them physically exhausted. That's why they prefer constant rest. That's why all their symptoms get ameliorated by taking rest, by sleep, by lying down. This is a striking feature of psora regarding the modality as well as rest. Since they faces the itching, the psoric personality always have the skin complaints. They have the aversion to the bathing because of the alteration in the reason of, for sometimes, for example, some psoric personalities, whenever they are taking bathing, their itching will get aggravated, or their burning or their pain will get aggravated because of their skin complaints, which comes under the psora. That's why both in psora as well as in syphilis, they will have the aversion of bathing to avoid the abnormal sensation, to avoid the abnormal itching, to avoid the abnormal burning. Again, the modality of the psora regarding the betterment by all the natural discharges helps them to be completely feel better by proper sleep, proper rest, proper eating, proper urination, proper voiding of stool. Everything helps them to be get ameliorated. All the natural discharges means all the natural discharges helps the psoric personality to be get better. During sleep or in the daytime, especially in the children, the psoric children faces the gnashing of the teeth, the bruxism, the grinding of the teeth. What is the emotional connection of grinding of teeth, especially in the psoric children? As I already told you, psoric personalities, irrespective of any ages, are highly intellectual and highly anticipated. Because of their anticipation, makes them to develop the lack of confidence, doubting their confidence, fear of survival of the fittest, fear of thriving out independently, makes them to develop the gnashing of the teeth and grinding of the teeth, which we call as bruxism. So, this is the functional level. Once the personality is rectified by proper counseling or selecting a simlimum, helps the particular children, or even in the elderly people. I know many individuals who snashes their teeth. This grinding of teeth, bruxism, comes under psora as well as syphilis. The difference between psora and syphilis is that gnashing of teeth will be very mild. Where the teeth is not get affected, the teeth structures will be retained even with the grinding of teeth. Where the teeth started getting powdered, where the teeth started falling down, destruction of the teeth happens because of the syphilitic stage of miasm, where the degeneration and destruction is very common. So, regarding the gnashing of teeth, this gnashing of teeth is also common in psoric stage of miasm because of the involvement of the parasites, involvement of the worms, especially the pinworms or roundworms, which is expelled out with or without medicines through stools by proper simlimum or without medicine intervention, where the gnashing of teeth is very common. Because of the intolerance to the extremes of weathers, they always faces with the hot flushes. The sensation of hot flushes is very predominant, which is a characteristic symptom of glowing, sepia, aconite, especially during fears. Even in arsenicum album, it is a symptom of expression of hot flushes in eyes, ears and face because of the constant anxiety, constant dwelling of the past bitter events. Sometimes because of the expression of the constant rhinitis even in the no symptoms in psoric phases without medicine intervention or periodical epistaxis will be seen, especially in the expression of going to the mountain hiking or change of extremes of weather or during puberty time or during menopause time. They will express, especially in the psoric stage, with epistaxis, one nostril or both nostrils with spotting few drops only by few seconds, which can be recovered with medicine or by selecting simlimum in the constitutional state in the later stages. Especially in the children and especially the personality, even in the elderly people, they will have the bedwetting enuresis, nocturnal enuresis, and incontinence of urine is seen in psoric individuals, which is very functional because of the anticipation or because of the reason of worms' existence in their body. Once their confidence level get corrected through medicine or mental counseling, helps them to overcome the nocturnal enuresis, which is very easier to treat in a short period of time, especially when they are in psoric stages. Considering regarding their stools, they always have the patterns of irregular stools, sometimes constipation, sometimes diarrhea, because since they are physically also sensitive, some foods makes them disagrees. Like fatty foods disagrees in pulsatilla, or stimulants disagrees in veratrum album, or mental emotions causes diarrhea in argentum nitricum or gelsemium, which comes under the psoric stages because of the food or because of the environment, because of the mental exciting cause, mental ailments, develops diarrhea, watery stools, or the constipation related with the strong fixed ideas, which is also again the feature of the psoric miasm. Because of the alternating of the stools, no two stools are alike. In later stages, they develop internal piles without blood loss, blind piles, anal fissures, initial stages, fistula in ano without any discharges or without any structural changes, and earlier initial stages of rectal prolapse also comes under the psoric stage of miasm, considering the anus and stool part. Considering the male part, it always connected with the false evil thinking, the lack of confidence, and the lack of fear of thinking that even the normal hormonal changes is a sin. This consideration makes them to develop in the later stages with infertility or impotence because of the constant bullying of the opposite gender or constant bullying of the parents, make the children to feel that they are not caliber enough to be a male or female, making them to feel the partial difference, partial discrimination showing through genders. These ailments comes under the psoric stage of miasm. All the functional disturbance of menstrual disorders comes under the female reproductive system, especially with the dysfunctions of like irregular flow, or irregular cycle in the later stages after puberty. Though they attained menarche in the proper age, for 1 year or 2 years there will be irregular disturbances. One cycle will be 30 days or one cycle will be 45 days or one cycle will be 25 days. But everything is normal, which also comes again with functional disturbance of menstrual irregularities of psoric phases, where there won't be any dysfunction, derangements or destructions in the organs, particularly in ovary or uterus or vagina. There will be only leukorrhea, that too will be very bland and scanty. So, considering this leukorrhea part, which is very common especially in the ovulation period, in the teenagers and the female girl who comes under the pre-puberty stage, which is very common symptom, or after puberty or after menses appearance during ovulation, comes under the psoric stage of miasm. Only the functional disturbance, where there won't be any offensiveness. The leukorrhea will be very watery, bland, like hazy crystal clear, like glass, without excoriating the linen or without staining the linen, without creating any abnormal sensation in the abdomen or back. Because of the long-standing skin changes in psoric stages, the ulcers or vesicles formation of thigh, ankle and foot is very common in psoric stages because of the vitamin deficiencies or because of the poor improper nutrition and because of the derangement due to mental sensitivity by expressing out because of change of weather or change of water or exposure to the extreme heat or extreme cold makes them to develop vesicles or ulcers, which can be rectified in a short period of time using hexaximlimum in homeopathy. All the psoric disturbances, all the diseases exhibits through psoric phases with initial stages of every organ inflammation, which can be eliminated easily by natural discharges and physiological eliminative process through diarrhea or vomiting. That's why in acute simlimum, whenever we are giving medicine for fever or extreme cough or extreme wheeze, when there is simlimum, the people get recovered by expressing out by sudden bout of vomiting one time or sudden bout of diarrhea, helps them to restore to the health in an easier way. This is the enlightening and highlighting feature of psoric miasm. Today I will complete the psoric miasm. If possible, in later classes, I will start with psychosis as well as syphilis miasm. Either I will complete both the miasm in one class or in 2 classes. Thank you for watching this. Kindly watch it through live session, which helps you to learn, to acquire knowledge beautifully through live session, which helps you to gain and acquire easily, which helps you to retain in your memory, and also watching recorded session, which helps you to restore it for a longer period of time. Thank you. Stay tuned.